My name is Aderonke Olola. I'm presenting the role of an occupational therapist in healthcare profession. The aim of this presentation is to express knowledge of occupational therapist's role and responsibilities in the healthcare setting, stressing on their collaborations with other allied health professionals, including their limitations and strengths, and how the government policies impacted on them. The role of occupational therapists has evolved over time and emerged as a profession in 1917 in the United States of America, and now is officially named as occupational therapists in 1920. In the UK, they were first employed within local authorities in the late 1960s and early 1970s to meet new responsibilities in the provision of equipment and housing adaptation services under the new legislation. Their roles broadened throughout the 1980s and 1990s as successive reforms sought to expand community care and reduce residential home placements, requiring occupational therapists, OTs, and allied professionals to increasingly promote the support support independent home. Subsequently, a ground well of concern emerged concerning timely access to equipment and adaptation, and a lack of response between those with high and low level needs, resulting in pressure for change within community-based occupational therapy services, as documented by the Audit Commission 2000 and 2002. What is occupational therapy? Occupational therapy, OT, is a science degree-based health and social care profession regulated by the Health and Care Professions Council. Occupational therapy takes a whole person approach, which we call an holistic approach to both mental and physical health and well-being, and enables individuals to achieve their full potentials. Occupational therapy practitioners provide habitation and rehabilitation services, which are among the essential health benefits of the Affordable Care Act (ACA), with holistic approach complementing the ACA's focus on wellness and prevention. By focusing on wellness, managing chronic disease, improving functions, and supporting independence, occupational therapy practitioners can help the interprofessional primary care team improve outcomes while decreasing costs. Allied health professions make up the third largest clinical workforce in the NHS. There are 15 different roles working across the range of sectors, from emergency response and diagnosis to mental and physical rehabilitation. These are AHPs. What does an occupational therapy do among the AHP? Occupational therapist's job role is to help people of all ages overcome the effects of disability caused by illness, aging, and accidents so that they can carry out everyday tasks or occupation. And occupational therapist considers all the patient's needs, both physically, psychologically, socially, and environmentally, and they make real difference in giving people support to give them a renewed sense of purpose, opening new horizons and changing the way they feel about the future. New policies in England emerge, and this changes the way the allied health professions, including occupational therapists, operate. We have three interrelated themes. First, the occupational therapy role has developed with the evolution of specialist assessment, for example, through the introduction of single assessment points in older people's services, and the occupational therapy assessment in transition reviews as young people with learning disabilities and complex needs move to other services. Secondly, reforms aimed to improve access to equipment stores, integrated community equipment services, combined NHS and local authority resources, and provided free provision to those with an assessed need for all items under 1,000, according to the Department of Health 2001b. Finally, a growing emphasis has been placed on key cross-professional teams with direct consequences for practitioners. This includes preventative care, with an expansion of such services advocated in Caring for Our Future, according to Department of Health 2012 and NHS England's 2014 forward strategic document. As a way of reducing reliance on crisis support, the growth of intermediate care has additionally changed traditional occupational therapy roles. Importantly, how NHS and local authority manages boundary between services has changed, with occupational therapists playing a key role in integrated care through multidisciplinary team. There's impact of the new policy development of diary on the way the occupational therapists operate. Despite the fundamental impact that such changes may have on the occupational therapy role, however, there are very little or not known about the breadth of OT activities, the aspects of the role that account for most time, nor about differences in time used across settings between qualified and assistant grades is not evaluated. Most of the time, the schedule for use by occupational therapy described and appraised was not seen or acknowledged by anybody, and this accounted for the working time spent by occupational therapists and assistants in an integrated health and social care trust in England. Diary tools in adult social care as practitioners' roles and responsibilities increases. We realize that most commonly the schedule are being used with social work teams in local authority, in community mental health services, hospital-based social work, continuing health care and intermediate care setting. Diary data have multiple uses as a means for simply describing practitioners' role and responsibility, for evaluating change, in providing a basis for costing new or an existing activity, in linking with other data, e.g. other job characteristics, caseload characteristics, and all of that, which provides a means of exploring a whole wide range of research questions. There's what we call the OT process, which is a term used to describe the entire interaction between client and therapist and all steps that comprises that process as explained in the practice framework. There are three main steps to the occupational therapy process: the evaluation, intervention, and outcome. We engage in occupation to support participants, and intervention planned out, implemented, and reviewed. An occupational profile analysis of occupational performance is measured according to the collaborative process between practitioner and the client. OT focuses their work on improving the health and well-being of the patients to live full and active life, complete their family cycle, social network, and workplace. The occupational therapy framework tells us what we do and how we do them. It provides rehabilitative services to individuals with mental, physical, and developmental impairment. Whether someone has trouble performing day-to-day activities due to an illness, injury, or disability, occupational therapy is about teaching people how to work within their limitations so they can live as independently as possible. There are regulatory bodies governing occupational therapy roles. Graduates are eligible to register with HCPC. Registration allows us to practice as an occupational therapist within the NHS, community services, local authorities, as well as social enterprises and private sector. And the HCPC, formerly known as Health Professions Council HPC, is the regulatory body for occupational therapists and 14 other allied health professions. A selection of occupational therapists are audited by the HCPC every 2 years, and the Royal College of Occupational Therapists provides members with advice about the HCPC registration and audit process. And this is a main responsibility of every occupational therapist to ensure that they are registered with their regulatory bodies. What does HCPC Royal College of Occupational Therapists stand for? They are the professional body that represent the UK's occupational therapy professionals, students, and apprentices as they enable or learn how to enable people to live their lives to the full. They ensure all registered professionals abide by the professional standards for occupational therapy practice, conduct, and ethics. And this is the major role for the regulatory body, to ensure that every registrant is controlled and abide by the standard of the organization. The conduct and the ethics, principle and standard, and their capability and fitness to practice is all measured under this regulation. Rules and Allied Health Professionals in Public Health England is compiled by Linda H. et al. In 2015 on the role of allied health professionals in public health. Example of interventions delivered by allied health professionals that improve the public health reveal that AHPs are focused on therapeutic interventions for individuals, and the outcome measure and research reflects their clear interventions by AHPs impact the health of the wider population. These outcomes on overall health and well-being of individuals and had stimulated a desire in England to widen the public health workforce, contributing to health improvement, which requires a commitment from AHP at local level to collect and aggregate data and to make the impact of their intervention more explicit. The study also further established that demonstrating impact across populations would allow AHPs to systematically better the population health and well-being and address health inequality. Defining role and responsibility of OTs, we realize that role is not a responsibility and responsibility is not a role. Many people mistake a role as the job title, but there is more to it than just a designation. Each position is associated with sets of responsibilities. The main role of an occupational therapist within a multidisciplinary team is to provide the client with strategies, techniques, equipment, or home modification that enables them to return to the highest level of functioning possible and allow them to re-engage in valued roles and occupation. According to Alta 2013, Reed 2014, JCM 2017. Occupational therapy can also provide a wide variety of assistance to individuals recovering from both lower and upper limb amputation by providing therapy in relation to activities of daily living. There are changes that occurred to the role and responsibility of allied health professionals through the expansion, and the working pattern of AHP are changed to evidence-based informed practice, where research, academic findings, working with expertise, skills and knowledge from practice and promote the experience and the view of people accessing services, including families and carers. Work-based learning in healthcare environment change as a result of the changes that happens in the policy. Contemporary literature and theories on work-based learning has been explored. Recent trend promotes lifelong learning and implementing recent policies, fostering learning in healthcare practice settings. Changes also occurs in the roles and responsibility due to the changes in the AHP. We are experiencing great improvement in the healthcare system, improving partnership among the AHPs and others. The NHS has joined the apprenticeship scheme and training of AHPs with an increase in the number of occupational therapists that have been to be trained is ongoing, filling the skill shortage system. Now, in the RCOT 2021, which is Royal College of Occupational Therapy, there are standards that have been documented in 6.42 to 6.46 regarding the roles and responsibility of an OT. Working in partnership with AHP and MBT while upholding their responsibility, OTs work closely with every single one in the team, helping people to live and not just exist. Effectiveness of the MDT approach reveals that the patient have access to an entire team of experts, improves service coordination, expedites the referral process, creates new avenue for service implementation, allows patients to create goals for themselves. However, we have limitation of the MDT. There is always a time pressure involved in providing services, too many opinions and perspectives, and these are points of conflict between them. Different teams members come from unique backgrounds. It requires frequent collaboration to be effective, depends upon available resources. Incomplete decisions happens without complete information most times, and if it wasn't documented, then it did not happen. In conclusion, we see that an occupational therapist skill lend themselves to new emerging roles, such as working with asylum seekers or refugees, working alongside police or fire services, or liaising with psychiatric services, even in schools identifying vulnerable children. We are pleased that researchers are attempting to measure the effects of non-pharmacological intervention like occupational therapies, despite the complexity of doing so. For example, two things that complicate researching interventions for individuals with Alzheimer's disease and related disorder includes a progressive neurodegenerative disorder with a disease trajectory that worsens over time. There is no cure currently or a way to reverse the effects of this disease. The overarching goals of care are to maximize function and quality of life in the face of a deteriorating condition. These goals may be clearly aligned with occupational therapist philosophy, but are more difficult to translate into traditional rehabilitative care setting and model. This established that occupational therapy intervention can benefit individuals with dementia, both cognitively and behaviorally, with great value to the healthcare professionals. OTs work with employees and employers to identify reasonable adjustments that help people find, remain in, and return to work. OT sees beyond diagnosis and limitation to people's hope and aspiration. Now we need government, healthcare leaders, commissioners to see these things too and to dedicate resources, fundings for more people to receive occupational therapy in the country. Hashtag OTs for equity. These are my references. Thank you for listening.